Welcome to Understanding Cancer. Today we're speaking with Dr. Denise Yardley, the Director of the Breast Cancer Research Program at the Sarah Cannon Research Institute in Nashville, Tennessee. Welcome.
Thank you.
When many patients are first diagnosed with breast cancer, they are offered a range of treatment options. And I think of them in two broad categories. I think of local therapies and I think of systemic therapies. And I think it confuses patients a little bit, understanding that there's kind of two different aspects to the treatment of breast cancer. Could you kind of walk our listeners through?
And that's a great point, and I think it's a point that I spend a lot of time in discussing this with patients. I think we look at our surgeons as really a local therapy. That's their major role, is trying to remove the breast tumor and assess the lymph nodes and remove any effective lymph nodes. And those are all measures to really locally treat the breast cancer. Information from that tells us how much at risk the patient might be of having disease pop up microscopically on their skin, in their chest wall, or if they've had breast conservation. And with a diagnosis of breast cancer, the possibility that a cell may have escaped either through the bloodstream or lymph node channel to somewhere else in their body, liver, lung, bone, is the role of systemic therapy, or what chemotherapy goes after hormonal therapy. It really is designed to go through the body and circulate through the body. The local therapy is really limited to surgical removal of the tumor, and that gives us a lot of information on the risk of it going somewhere else. And then radiation. And radiation is done only to reduce the risk of disease coming back, either on the chest wall or where their lymph nodes were removed from. And it's typically that radiation is involved in patients who have larger tumors or several lymph nodes involved to really reduce local or involvement on that chest or chest and skin. And the chemohormonal therapies is really designed for the risk of a cell having escaped that and gone somewhere else in the body that may be hibernating.
So in a patient with early stage breast cancer, they really have a choice to make. They can either have complete surgical removal of a breast, a mastectomy, or they can have breast conserving therapy, a lumpectomy, a segment of the breast removed containing the tumor, but then they have to have radiation.
Yes.
A lot of women I talk to really struggle with trying to decide whether they should get a mastectomy or a lumpectomy and radiation. How do you help them sort through that dilemma?
We talk about some of the studies that have really shown, and I think it's natural to think sometimes removing all the breast tissue really is a more aggressive and powerful treatment and may impact on their risk of disease coming back, so that may lower their chances further. And that really has not been borne out by the trials. You have to treat the whole breast. So I explain it to patients by removing it surgically or removing the tumor and treating the breast with radiation. Now, there are certain patients that we think probably would be best managed with surgical removal of the breast, and it reduces the risk of any disease coming back at the site of the lumpectomy or other sites of the breast. But for the most part, survival has been shown by the trials to be very equivalent. So if a patient is a candidate for having the tumor lumped out, then I advocate that for the patient if the patient's willing to undergo the radiation. We've made such big improvements now in radiation that the typical course is about 6 weeks. We've now added what we call accelerated radiation, which is a shorter course, and then mammocyte radiation, which is the newest. That's a 5-day course of radiation that really makes that radiation treatment a lot more convenient for patients. There's certain patients that aren't good candidates for it, but for patients who are, it's a great acceptable alternative now to the 6 weeks of radiation.
Well, Dr. Yardley, I'd like to thank you for your time today. I think our viewers will find this session most informative, and we look forward to having you back.
Thank you.